For this current event presentation, I chose an article titled, the title's pretty long. The article title is The Ethics of Ordinary and Exact Justification in Blood Donation Deferral Categories for Men Who Have Sex with Men. This article was written by Kurt M. Blankshin and it was published in 2017 by the Wiley Bioethics Journal. In this article, the author discusses the ethics of potential blood donors among men who have sex with men, or MSM. The previous policy from the Food and Drug Administration Agency, or the FDA, prevented all men, all MSM, from donating blood. Now, the updated policy requires MSM to refrain from sex with men for 1 year before they are eligible to donate. The author argues that not all MSM carry the same risk and that MSM should be categorized based on their risk factors and their serostatus, basically whether they have HIV or not, rather than the fact that they are having sex with men. As for the bioethical dilemma presented, the author states that the principle of justice is being threatened because all MSM are being grouped as one rather than being based on their risk factors. Therefore, there is a case for injustice because it involves a wrongful act or omission that denies people resources or protections to which they have a right. The author, however, recognizes that donating blood is not necessarily a right, but preventing people from donating blood just because of their sexual orientation, not because of their serostatus, can be a form of discrimination leading to social marginalization and stigmatization. This article is important to me because I feel that all of our patients deserve equal rights and equal opportunities. As the LGBTQ community grows in numbers and as detection and treatment for diseases such as HIV and STIs improve, so should our policies be improved and updated to keep up with the times. And moving on to the Code of Ethics, according to the Code of Ethics for Nursing, justice requires that vulnerable groups receive special protection, and this is directly from Fowler's Code of Ethics for Nursing. And justice as an ethical principle deals with fairness in the distribution of social burdens and benefits. Therefore, as nurses, we have a duty to uphold Provision 9, which states the profession of nursing, collectively through its professional organizations, must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and health policy. Now, the last question for this prompt is, what implications for healthcare does this issue present? According to Dr. McCormick, who is a senior lecturer of the University of Washington Medicine's Department of Bioethics and Humanities, he states that the demands of principle of justice must apply at the bedside of individual patients, but also systemically in the laws and policies of society that govern the access of a population to healthcare. So as the LGBTQ community expands, we should also revise our healthcare policies to accommodate the laws and policies for the many subgroups of the LGBTQ population.